may be seated. Honorable members, before we start, I just want to make an announcement. I wish to inform members that an agreement was made in the Chief Whip's Forum that the smaller parties would be allowed to donate time to one another. The speaking time for smaller parties will not exceed 4 minutes. And the minutes donated will be from a party not participating in the debate. Arrangement in this regard are to be done prior to the sitting and as reflected on the speakers list. I thank you. I will now call upon the Honorable Minister of Health, or the order. Oh, sorry. Honorable Minister, just a minute. The Secretary, please read the order of the day.
Debate on vote number 16, Health Appropriation Bill.
The Honorable the Minister.
Madam Chair, my colleague Deputy Minister of Health, Dr. Joe Pasha, my colleagues Ministers and Deputy Ministers, Chairperson of Portfolio Committee, Honorable Dunjwa, Honorable Members of the Portfolio Committee, Honorable Members of the House, distinguished guests, good afternoon. It's my honor and pleasure to present to this Honorable House the 2015 Budget Policy Statement of the Department of Health for your consideration and approval. Honorable Members, in the previous financial year, a sum of 33.95 billion was voted by this Parliament for the Department of Health. In using this appropriation, we did have our achievements, but also challenges, which I hope to reflect on. Let me start by reminding this Honorable House that South Africa now has a plan. The first ever plan, pre and post-apartheid, the National Development Plan. We are aware that there are some individuals or even organizations that have reservations with the National Development Plan or Vision 2030. In some instances, maybe rightly so, however, I wish to take this opportunity to reassure this House that in as far as health is concerned, we have no reservations at all. There's no reason for anybody to have any. What I'm saying is born out of hard facts which are available for those who might be interested. In the health demands of the African claims of 1943, in the Freedom Charter, the National Strategic Plan of HIV and AIDS 2012-2016, the plan to end HIV/AIDS by 2030 as agreed at the Melbourne International AIDS Conference in Australia last year, the United Nations Millennium Development Goals of 2000, the World Health Organization 1998 Alma-Ata Declaration, and the 6 building blocks of healthcare as declared by the World Health Organization. All these can easily be identified and recognized in the health chapter of the National Development Plan. Hence, honorable members, I wish to reiterate that every single vision in the Department of Health, policy, plan, program, or decision will be based on the plan. This budget policy statement is going to be no exception. For those who might not be informed, let me read here what the NDP envisages by the year 2030, and I quote, "We envisage that in 2030, South Africa has a life expectancy of at least 70 years for men and women. The generation of under 20s is largely free of HIV/AIDS. The quadruple burden of disease has been radically reduced compared to the 2 previous decades, with an infant mortality rate of less than 20 per thousand live birth and under 5 mortality rate of less than 30. There has been a significant shift in equity, efficiency, effectiveness, and quality of health care. Universal health care is available. The risks by the social determinants of disease and adverse ecological factors have been markedly reduced. Has been significantly reduced, close quotes. However, Honorable Speaker, Chairperson, I wish to warn that there are 3 issues which will finally determine or even dictate whether these noble goals are achieved. Number 1 is the successful implementation of NHI. Number 2, the outcomes of the Competition Commission's public market inquiry into the cost of private health care led by former Chief Justice Sandile Ngcobo. And number 3, issues pertaining to the explosion of medico-legal litigation, whose facts I'm intending to bring in front of this House. This will be full facts and not half-truths that are being bandied around. These three issues, Honorable Speaker, are to determine whether the country goes forward or backwards, or whether any national development plan is implemented. I also want to plead to this House not to regard health in isolation or regard it as just one component of social imperatives of government. There's a general agreement now around the globe that good health is a key ingredient of development. There's general consensus about this even among organizations as diverse as the World Bank and the World Organization. Let me quote the president of the World Bank, Dr. Jim Yong Kim, on this relationship, and I quote, "There is evidence that investment in people like healthcare, education, and social protection are not just good for the individuals who directly benefit, they are also good for their country's growth and political stability. Likewise, I believe that not providing health, education, and social protection is fundamentally unjust, in addition to being a bad economic and political strategy," close quote. Dr. Kim said these words while speaking on the topic of universal health coverage, which in South Africa we call NHI. He was doing so on the 14th of January 2014. The relationship between health and economy, as well as social and political stability, has been seen recently with the Ebola outbreak in the 3 West African countries. As you all know by now, South Africa has thus far not had a case of Ebola. We took the necessary steps and precautions and put up necessary contingency plans. We, however, need to ensure that we continue to be vigilant. This outbreak has also forced us to redouble our efforts to get everyone to wash their hands. I launched the National Hand Washing Campaign last year to advise the nation about the importance of hand washing because it will help against Ebola and other diseases like influenza and gastroenteritis. Yesterday, health workers washed their hands and thousands more are going to do so today in recognition of Hand Hygiene Day for health professionals declared by the World Organization. I wish to thank our partners at home, both public and private, for their support and cooperation in the fight against Ebola in West Africa and for prevention measures at home. Africa has learned extremely important lessons with Ebola. The first and the biggest lesson learned is that weak healthcare systems make it virtually impossible to prevent and manage disease outbreaks. Whether it's Ebola, meningitis, TB, HIV, AIDS, polio, malaria, or whichever outbreak it is, if the overall health system is weak, such an outbreak will be unmanageable. What do we mean by weak health system? We simply mean inadequacies in the following areas, and I'm not going to mention all of them, obviously, but it's information system, health facilities, infrastructure, equipment, number of health professionals, supply chain processes, financial management, and ability to coordinate development partners and assistance from international organizations. It's for this reason, honorable members, that the World Organization in the African region held in Cotonou in November last year, we as ministers of health decided to break with the past. Ordinarily, the budget of the World Organization is based on medical programs. For instance, budget for malaria or for polio or for HIV, AIDS or TB. We argued as ministers of health that these medical programs are by themselves not going to propel the continent forward. We believe that what will propel the African continent forward in health to withstand whatever emerges as an outbreak will be strong healthcare system. Yesterday it was HIV/AIDS, today is Ebola and TB, tomorrow is what? We do not know, Chairperson, but we believe that some other outbreak might actually emerge. There are 3 reasons for saying so. Number 1, the reasons climate change. We don't know what disease patterns climate change will bring. Number 2 is the increasing encroachment of humankind in the habitat of other species in search of food, water, and shelter. Number 3 is the ever-increasing emergence of the post-antibiotic era. This, honorable members, is precisely why the NDP, as well as the World Organization, believe that strengthening health system is a key to countries' development. Hence, in Benin, we took a resolution that the World Organization must change. They must make strengthening healthcare system a flagship. It does not necessarily mean that the medical programs will be ignored, but the flagship must to have a strong healthcare system. Honorable Chairperson, during the 2014-15 financial year, the department has been busy putting up plans to strengthen the healthcare system. This will include preventing diseases, promoting health, and making sure that our people get good quality healthcare. This is our mandate and we shall pursue it with vigor. This does not mean that vertical programs are going to be abandoned, as I've said, but it simply means that the flagship is strengthening healthcare system. In our country up to so far, our vertical programs have actually achieved a lot, and we have announced many times in this house the increased life expectancy, the dropping in mortality, overall mortality, neonatal, infant, child, and maternal mortalities, the marked reduce in mother-to-child transmission of HIV. We're on the verge of eradicating malaria. We have got big progress on vaccine-preventable diseases, etc. One area of healthcare which is commonly undermined by public utterance from politicians, the media, and sometimes even members of the public is the area of prevention of disease and promotion of health. Curing disease is always regarded as a noble scientific feat, and preventing them is never regarded as a scientific achievement. Hence, the most sustained focus in the public arena will always be what is or what is not happening inside the hospital or clinic. In fact, the performance of the healthcare system is usually based on the goings-on inside the hospital or clinic. That's why one negative event that takes place there is almost immediately regarded as a collapse of the entire health system. This, of course, is a knee-jerk response. No matter what distractors say, we will not abandon or weaken the preventative aspect of healthcare. On the contrary, it's going to be the foundation of program of our healthcare system strengthening. Honorable Speaker, in pursuance of these goals, in 2009, we introduced 2 new vaccines, the rotavirus vaccine and the pneumococcal vaccine, to avoid reliance on anecdotes and arrive at wrong conclusions. At the time of the introduction, we requested the NICD, National Institute of Communicable Disease, to monitor the impact of these new vaccines on the population. I'm very pleased to announce that the results were overwhelming. NICD found 70% decline in invasive pneumococcal disease of children under 5. Pneumococcal diseases are dangerous diseases like meningitis and pneumonia. That we decrease this by 70% is something we cherish. Sadly, in today's narrative, it may count for nothing. What will have counted was if I were to announce that we allow children to catch pneumonia and meningitis and successfully treated them. That type of announcement will have found resonance. I read with trepidation one media report bemoaning the fact that South Africa did not get Ebola and that this deprived the country to test whether the health system is working. That we went on prevention is not actually being regarded. I'm announcing today that we actually prevented 70% of children from catching pneumonia and meningitis, and we think this is very important. In addition, the NICD found that there is 66% reduction in rotavirus viral disease hospitalization in the 2-year age group. Honorable Speaker, we are spending 450 million rand per annum on pneumococcal and 200 million on rotavirus. But as I said, the most important gain here is that mortality among children under 5 has gone down because of this, among others, together with the ART program. The Road to Health booklet is our children's passport to health. We need to use it to ensure our children are fully immunized and protect against vaccine-preventable diseases. It's also used to monitor the child growth and ensure that a child that falters can receive attention that they need without delay. It contains messages that can alert the caregiver to the danger signs that require urgent medical attention. I therefore call on all caregivers and health professionals to check the Road to Health booklet and ensure that all children get the vaccination from birth to age 12. Let me move to the mothers of this country, the source of life and sustenance in the whole universe. In August last year, we launched the Mom Connect project at Mutubazi Clinic in Soshanguve, Tshwane. This project uses cell phone technology to register pregnant women, all pregnant women in public and private health care. This empowers them to get information to ensure that they get good instruction on how to take care of the baby. After delivery, the messages switch over to how to take care of the newborn. Oral Speaker, I'm very happy to announce that in a short space of eight months, we're able to register 383,000 women. This is regarded as the largest in the world. Before we started, the country which was regarded to be the largest was Bangladesh with 100,000 women in 18 months. The other countries only have smaller projects. The system does not only dish out information, it also enables the mothers to send unsolicited complaints and compliments. The complaints and compliments we received up to so far, Honorable Chairperson, is that we have received 1,553 compliments and we have received 290 complaints. To summarize the compliments, number one is thanking us that the messages are useful. Number two, that the service they received has been good. Number three, that individual nurses do exert themselves beyond the call of duty. The complaints we received, the first and the biggest one, is waiting times in the public health facilities. We, of course, knew about this problem in 2010 when we did our health audit. The reasons, Honorable Chairperson, is that in 2004, we had 400 people on ARVs. Today, we have got 3 million, which is 30% of the global average. When you add the explosion of non-communicable diseases like diabetes and high blood pressure, our clinics are markedly congested. So we need solutions, and we are putting together solutions in the Department of Health, Honorable Chairperson. I wish to thank our development partners who help us with Mom Connect to register these 380,000 women. The main partners were the United States government through the OGAC office and also Johnson & Johnson. MTN, Cell C, and Telkom contributed by giving 50% discount and Vodacom by giving 30%, and they are prepared to move even higher. Our intention is to register all the 1.2 pregnant women in our country. I wish to take this opportunity to acknowledge the presence in the gallery of Mr. Piso Magwetla, the SAFM journalist who volunteered to be our Mom Connect ambassador. She traveled the length and breadth of the country and encouraged pregnant women to register. We thank her for the job well done. Just like with the NCD, we have asked the University of Stellenbosch and University of Western Cape to evaluate Mom Connect to tell us its impact on pregnancy and childbirth in the country. We are expecting results in a year. Honorable Chairperson, the President of the country launched Operation Pakisa Ideal Clinic on the 18th of November. Operation Pakisa Ideal Clinic deals with 8 aspects of healthcare, and the people in the laboratory were divided into 8 streams. And we believe if these streams can work very well, the healthcare system will improve. The first stream is human resources. The second one, financial management. The third, supply chain management. The fourth, infrastructure. The fifth, waiting times. The sixth, service delivery. The seventh, institutional arrangement. The eighth, scale up and sustainability in the healthcare system. We are hoping that this will be promoted. Honorable Chairperson, I do not want to finish this speech without mentioning what the President said in the State of the Nation, and I quote him. Over the past 5 years, government has scored significant gains in health. This year, we are going to launch a massive program to turn the tide against tuberculosis. And I close quotes, Chairperson. While the huge and successful program has helped us to deal with TB, the epidemic is still very high, as indicated in the President's State of the Nation address. We identified 3 areas where this epidemic is a problem. It's correctional service facilities, the mines, and peri-mining communities. And we also looked at the districts. Which district has got the highest TB incidence in the country? Number 1 is Luvelipuzo in the Free State. Number 2 is Kenneth Kaunda in Northwest. Number 3 is Waterberg in Limpopo. Number 4 is Western Gauteng, especially around Carltonville. Number 5 is Bojanala district in Northwest. And number 6 is Skukune district in Limpopo. On World TB Day, March 24th, the Deputy President of the country, Mr. Cyril Ramaphosa, launched the biggest TB screening program that has ever been. The launch took place in Ogni for obvious reasons. When we finish screening in these areas, in these districts I've mentioned, we are going to move to the 6 metros, especially the eThekwini Metro and the Cape Metro, which are the most affected. From the metros, there are 4 provinces which are badly affected. That's Eastern Cape, Gauteng, KwaZulu-Natal, and Western Cape. We would like members of parliament to join to spread this message. And there are 3 simple messages: get screened, get treated, and get diagnosed. Chairperson, let me just indicate what I'm talking about here. After screening in the 6 districts, we screened 36,415 people, and we found that 3,256 were actually having TB, and 57 of them is drug resistance. All these people did not know their TB status before the screening. That's why I want all of you to subject yourself to screening. Yes. But also to show you exactly the extent of the problem in the country. When I shared a platform on TV with Professor Shabir Mari, Professor Shabir Mari is the director of the National Institute of Communicable Diseases. He said South Africans should not worry themselves about Ebola because the chance of contracting it are very slim. They must worry more about TB. He was insulted. People said the professor is taking us for fools. He believed because we are not professors, we don't understand these things. We all know what is more dangerous. He can't tell us TB. I'm not here to protect Professor Mari, but here are the facts. Since he spoke these words, nobody died of Ebola in South Africa, but 40,540 people died of TB. Facts speak. Honorable Chairperson, in conclusion, let me briefly summarize the budget request from the National Department of Health. For 2015-16 financial year, the proposed budget that we are requesting your approval is 36.46 billion. This is broken down into 4 components as follows. 772 million for compensation of employees, 1.579 billion is for goods and services, 33.448 billion is for transfer. These are the conditional grants that we provide transfer provinces. And 668 million is for capital expenditure. The total budget represents 7.4% increase when compared to the 2014-15 budget. I request this House to approve the budget of the National Department of Health for 2015-16 financial year. Thank you very much.
Ra leboga. Minister Motsoaledi. Ke tlo bitsa leloko le le hlomphegilego la ntlo, Honorable Dunjwa.
Mandibulise isihlalo obekekileyo wendliwiso mthetho. Ohloniphekileyo uMinister wezempilo nesekela lakhe. Amalungu ekomiti yezempilo. Amalungu alendliwiso mthetho. Indwendwe zethu. Abantwana besikolo abazosimamela. Amaqabane izihlobo noMzantsi Afrika uphela. Xa simileyo namhlanje sisithi siyikomiti yezempilo. Siyayiseka athi amakhumsha siyayisupporta i-budget vote 16 yezempilo. Xa simileyo namhlanje xa besisuka ku-27th ka-April sigubha sivuyisana nokukhuleka kwethu. Xa simileyo apha namhlanje sizokuthi sigqiba iminyaka eyi-60 nge-26th kaJune 1955 xa i-Freedom Charter yayibeka ukuba sakuthini ke xa sikhululekile sikhokhela eli lizwe. Sikhokhela abantu balomhlaba balapha eSouth Africa. Ndizawuthi ke xa ndingena nzulu apho kule ntetho mpikiswano yam nditsho ukuba yathini na i-Freedom Charter kwezempilo. The Department of Health derives its mandate from the Constitution of the Republic of South Africa and the National Health Act number 61 of 2003. The department aligns its strategic plan to the National Development Plan 2030, which envisages a health system that works for everyone and produces positive health outcomes and is accessible to all. The NDP has identified the need to address the social determinants of health, prevent disease and reduce its burden. The department is making, the government, through the Department of Health, is making significant efforts to combat the quadruple burden of disease and illness. At the forefront of this are HIV/AIDS, tuberculosis, and non-communicable disease. Sihlalo, obekekileyo namalungu endliwiso mthetho, in reducing the burden of HIV, key is to strengthen intervention strategies such as increasing antiretroviral treatment coverage, increasing the number of medical male circumcision, and maintaining high levels of HIV testing and counseling. Our antiretroviral treatment program now reaches 3 million patients. Now, mamela ukuba sithi siyikomiti siyakungqina ukuba i-Department of Health ekhokhelwa ngohloniphekileyo umphathiswa uMtswaledi. Ezi zinto zizinto esizingqinayo uba bayazenza. Government through department has scaled up the prevention of mother-to-child transmission services by ensuring that all HIV-positive antenatal patients are placed on ART. The mother-to-child transmission of HIV has decreased from 20% a decade ago to 2% in 2014. I say today, 76.7% of antenatal patients have already been initiated on ART. In terms of improving TB prevention and cure, we do, Minister, we are witnessing the work that you people are doing as the department in terms of ensuring that the campaign on the strategic areas on TB screening is being done. We will monitor this as the portfolio committee on health. Same applies on Mom Connect. What we are requesting from the department on Mom Connect is to ensure that women in rural areas are also exposed to it, because those are the people that at times are being left behind. The NDP calls for the reduction of infant and child mortality. We have seen a marked reduction in child mortality over the past 5 years. This is commendable. The department will continue to reduce under 5 mortality rate to less than 30 per 1,000 live births by addressing malnutrition as well as childhood infections such as pneumonia, supported by improved access to antenatal services. The Freedom Charter, clause 9 of it, is saying, chapter 9, I'm sorry, in clause 4, a preventative health scheme shall be run by the state. Free medical and hospitalization shall be provided for all, with special care for mothers and young children. That is why, therefore, we are supporting the initiative and we are monitoring the rollout of the implementation of the National Health Insurance. The primary health care is the heartland of the transformation of the health system in the efforts of re-engineering primary health care. The number of ward-based outreach teams, contracting general practitioners, and district specialist teams are expanding school health services. And Chairperson, in the infrastructure, in the improved public health infrastructure and equipment, the department was able to establish the Health Infrastructure Grant in 2011. That is why we are saying as the African National Congress, people must go, Minister, to the handout of the 6th and see how then the infrastructure grant has improved the public health hospitals, which some of us in this house were saying, if a patient is taken to a public health institution, is left there to die. This article is proving the opposite of that, and we commend the Department of Health on that. Honorable House Chair, the work has been undertaken by government to strengthen decision-making through information managing and system support, the establishment of the National Health Information Repository and Data Warehouse, which is called NHIRD, which commenced in July, has now been expanded and enhanced. This has been rolled out to 9 provinces and 52 districts. There are currently almost 359 provincial technical support officers. They have been appointed on contract since 2013. These include 120 ICT support officers, 109 human resource support officers, and 122 financial support officers. And here we are told that the Department of Health, the government led by the African National Congress, there is nothing that is doing and there is no freedom. Yes, we do acknowledge that there are challenges in the Department of Health. The country is facing a dire shortage of health professionals and the admin staff. We will continue to talk about this, Minister, because if the admin staff is also not empowered and there is no balance between the two, we will always have a problem in the health institution. The target of neonatal and maternal mortality has now been achieved and there is the need for improvement. Community health workers, the community health care workers and coordination of their services, we are saying that must also be improved, because if then that is improved, the primary health care will then be achieved. The financial management at the Provincial Department of Health, slow response time and shortage of emergency response services remains a challenge. And we are saying in this House, all provinces must go and learn lessons from KZN where its emergency service is of good standard. The Department of Health has got 5 entities, namely National Health Laboratory Services, Compensation Commission of Occupational Diseases, South African Medical Research Council, Council of Medical Schemes, and the Office of the Health Standard Compliance. We want to say, we commend the Department of Health, government through the Department of Health, of ensuring that there is intervention, there is an intervention that has been made to the National Health Laboratory Service for it to be able to do its core business, which is testing. The focus of the Compensation Commission of Occupational Diseases financial year will include, we are saying here, this entity must be assisted in ensuring that it puts its acts together, and we are a bit concerned because it is governed by a legislation of the Occupational Disease in Mines and Workers Act number 78 of 1973. And as the Portfolio Committee, we are charging the department through you, Honorable Mtswaledi, to ensure that that is then reviewed. On the South African Medical Research Council, we are happy with the work that is being done by the South African Medical Research Council, but we are concerned that there is no coordinated work by this with other departments that are doing the same work in terms of the research and innovation, which is the science and technology and the others. But we're also much concerned about that this entity is still governed by an Act of 1958, and Act 58 of 1991, and in fact governed by a Constitution of 1985. We are standing here as the Portfolio Committee of Health saying we are giving this entity an 18 months period for it to ensure that that situation changes. We are comfortable and we're happy with the establishment of the Office of the Health Standard Compliance, which is to protect and promote the health and the safety of the users of health and services through monitoring and enforcing compliance by health establishment with norms and standards prescribed by the Minister in relation to the National Health Standard. What we have observed in terms of the entities, Honorable Minister, is that their transformation is very slow. They are not committed, we will say here confident, and they must prove that they are committed in transformation, because the Department of Health has set up a standard that we have got a high rate of unemployment in terms of unemployed graduates. We have said, we have articulated the numbers, but we are saying entities are not committing themselves in having a plan of ensuring that they take in a sizable number of unemployed graduates in terms of their expertise. And we are saying, charging you, Minister, as the political head, that in the next quarter, that must change. In the next quarter, we must be able to see that there is a change in ensuring that entities are contributing into in decreasing the high rate of unemployment. And we are happy, Honorable Minister, in ensuring, in conclusion, we are saying, in this house, people have been standing here and say there is no freedom. If you have never been in the cold face of the health sector, you will never understand. If you have never been in a health institution where patients were treated, if patients were treated according to color, even treatment, even food, even linen, you will never understand. Yes, we do understand that there are challenges. Yes, we do understand. But people are forgetting.
Order, honorable members.
But people are forgetting that we are, as the African National Congress-led government, dealing and correcting a legacy that we find in the Department of Health. Yes, because people were treated, you were never in the health sector. That's why you won't understand. And us, as people that have been there, we know. We commend. We are commending the Department of Health on putting up. Yes, you will howl. Yes, you will howl. Because truth hurts. Here in Cape Town, here in the Western Cape, in the government of Western Cape, they are refusing to take students to Cuba to train as doctors here in the government of the Western Cape.
Is the honourable member suggesting that the death in the hospital is a challenge?
Honorable Ollis, please sit down. You were not recognized.
And we are then saying, the program of the Department of Health, which is led by the African National Congress, is doing good work. Much is still to be done. We are not going to stand here and say there are no challenges. There are challenges. We are accepting that and admitting that as the African National Congress. But we are committed in ensuring that in moving forward in this year of celebrating the Freedom Charter, we are going to change the social conditions of our people in the health sector. I thank you.
Siyabonga ilunga elihlonipile. Honorable members of the public, may I request you. Firstly, let me say you are very much welcome to this house, but this is a sitting of the National Assembly, extended public debates. So may I please request you not to participate in the debates of the House. That means not even clapping of hands as members of the public. Thank you very much. Barelet, James.
Honorable Chair, provinces account for 90% of total public health spending. According to the Financial and Fiscal Commission submission on the 2015-16 Division of Revenue Bill, and I quote, health budgets will increase significantly when the proposed national health insurance is introduced, and therefore, unless the inefficiency issues are addressed, the problems will continue, unquote. In last year's budget, members, I highlighted the poor audit outcomes, this is for 2012-2013, for each provincial department. Well, I'm sorry to tell you that there's been no significant improvement. Limpopo, improvement from disclaimed with findings to qualified. The Free State stagnated on qualified with findings. The Eastern Cape stagnated on qualified. The Northern Cape stagnated on qualified with findings. Mpumalanga stagnated unqualified with findings. KwaZulu-Natal stagnated unqualified with findings. Gauteng stagnated unqualified with findings. The Northwest, something is going right there, unqualified, same as the previous year. And the Western Cape, of course, unqualified again. The identified root causes are, firstly, the lack of consequences for poor performance and transgressions. Secondly, a slow response, a tardy response by the political leadership. And thirdly, key officials, inappropriate competencies and vacancies or instability in key positions. Increased funding, members, for the Office of Health Standards Compliance is welcomed. According to Treasury, the focus over the medium term will be on accelerating the office's performance. Funded through transfers from the department, 85.2 million has been reprioritized over the medium term. Transfers received are expected to grow rapidly over the medium term at an average rate of 17.8% per year. Chairperson, the Democratic Alliances visited the following hospitals in the past few months of this year. Grooterschuur in the Western Cape, Livingston in the Eastern Cape, Albert de Toolie in KwaZulu-Natal, Palanomi in the Free State, Kuruman and Kimberley hospitals in the Northern Cape, Klerksdorp Chapong in Northwest, Baragwanath and Tembisa in Gauteng, Rob Ferreira in Mpumalanga, and Polokwane in Limpopo. Please don't tell us that we don't know what's happening in hospitals. What we found at these hospitals were quite shocking. Reliable electricity supply is a serious risk at Baragwanath, Rob Ferreira, and Palanomi. Staff shortages are causing unacceptably long queues at Palanomi, Kuruman, Klerksdorp Chapong, Baragwanath, and Rob Ferreira. It will become a problem at Tembisa once the innovative queue shortening EPWP programs comes to an end. Infection control, especially for tuberculosis, is a serious risk at Livingston. The proper disposal of medical waste is a serious problem at Kuruman and Palanomi. Tenders for the disposal of medical waste are a major opportunity for corruption and fraud. Minister Motsoaledi must therefore investigate this and tackle this problem as a matter of urgency. Stockouts of key drugs are endemic to the Free State and Limpopo, and let me say, Kuruman, Rob Ferreira, and Palanomi are in a chronic state of collapse. The key problem at poor-performing hospitals is the quality of their CEOs. Just walk into Kimberley Hospital or Grooterschuur Hospital to see what a difference a good CEO makes. On the 18th of January 2013, Minister Motsoaledi announced the appointment of more than 100 new CEOs for public hospitals, fulfilling his promise to ensure that these positions are filled by qualified people. A review of hospital managers published in 2011 found that some CEOs were political appointees with neither healthcare nor managerial qualifications. Some provincial health departments had appointed former teachers to run complex bodies with multi-million rand budgets. It does not seem as if Minister Motsoaledi's 100 new CEO project has had an even effect. He should provide a full and comprehensive report to the Portfolio Committee on Health on how he is advancing the course of appointing fit-for-purpose CEOs. The Department of Health is in its 4th year of the 15-year rollout of the National Health Insurance. The government's path to, I quote, universal, quality and affordable health care. Pilot activities are currently underway in 11 districts. The 2015 health budget states that plans are to release the NHI white paper in early 2015. The answer to a parliamentary question of March 2015 stated that the NHI white paper and the related Treasury finance paper would be out before the end of December 2015. A third of the way through the NHI rollout, we still do not know what the final policy is and how the government will finance it. This is to give a blank check in the midst of a serious fiscal squeeze. Pilot sites experienced various difficulties due to poor working conditions. The program failed to attract enough general practitioners, the consequence being that the conditional allocation has been reduced by 355 million rands to 884 million rands over the next MTF period. The NHI is a failing proposition. We should go back to the drawing board and design practical and workable social enterprise models to provide healthcare for poor South Africans, including the introduction of low-fee private public clinics. I thank you.
Thank you, Akbaralet. Ke tlo bitsa leloko le le tlhomphegilego la ntlo, Mme Mokause.
Thank you, Honorable Chairperson. Just to mention that I'll be sitting from now on in this portfolio committee, replacing Honorable Sam Matthias on behalf of the Economic Freedom Fighters. Honorable members must not come to this house and grandstand. make as if the health system, all is well.
Order,
All is not well.
order, honorable members.
If public figures were using public facilities, they could have known better. We still have hospitals that closes casualties due to lack of staff. And we still have hospitals, Kuruman Hospital being an example from the Northern Cape, that blood flows from the hospital right into town. But members come to this podium. Members come to this podium and grandstand. That is the truth. If you were using public facilities, you could have known better. This budget does not nearly come close to solving our health challenges in South Africa. And for that reason, we cannot accept it. While universal access to basic health care is a highly desirable goal which must be striven for, before placing too much confidence in the notion that expanding access to biochemical health care through NHI is the solution to narrowing the health gap, the broader social context for achieving greater equality in health outcome must be considered. The challenges are huge, and many, as much as the NHI is welcome as an intervention, a more fundamental solution will be to eliminate health problems before they arise through socio-economic empowerment. The primary healthcare system should essentially be about highlighting and solving the social determinants of health, principle among which is access to proper nutrition. But we do not know that because of the limited economic choices people have, which manifests in the fact that 1 in 4 South Africans go to bed hungry every day, South Africans simply cannot afford to be healthy, Honorable Minister. So comprehensive and adequate health care in the country is tied up at the hip with the economic freedom. The problem of public health provisions are propounded by the fact that majority of our skilled healthcare workers are in the private sector. About 70% of our doctors are in the private sector, saving a tiny amount of only 20% of the population, while the remaining 30% of doctors in the public sector serve 80% of the population using public health services. The Minister and the Department have not shown any urgency in addressing a private-public health divide, which is threatening to tear our health system apart. As the economic freedom fighters, we cannot accept or support the vote. I thank you.
Thank you, Madam. Ilunga elisokuniphekeleyo, Mamunkomo.
Thank you very much, Honorable Chairperson, honorable members, and all our visitors in the gallery. The IFP takes note that this debate occurs during a watershed moment for health in South Africa, as there is currently a bill of momentous import before the National Assembly's Portfolio Committee on Health. This is the Medical Innovation Bill, which was introduced by the IFP Dr. Mario Oriani Ambrosini MP, and after his passing, it was reintroduced by the IFP's Chief Whip in Parliament, Mr. Naren Singh MP. It seeks to create a legislative space, namely for the express purpose and object of medical innovation in cases where conventional treatments of illness is not effective, so that with the informed consent of the patient, other alternative medicines and treatments may be applied, and which include the use of medicinal cannabis, which is but one of the many possible innovative alternatives. The bill is not just about cannabis, though. The bill is about alternate medical treatment and relief from suffering for thousands of South Africans who would otherwise have no other option but to go home and die, being failed by current standards of medicines. The bill also seeks to give hope to those who have been told by Western medicines, open quote, "I'm sorry, there's nothing more that we can do for you," close quote, and will allow government through the Department of Health to take a crucial and a bold step towards innovative medical treatment and palliative care. More importantly, through this bill, such care will be available to all South Africans, not just the wealthy and those with a comprehensive medical aid scheme, as is now the case, especially when talking in terms of the cancer and its related and prohibitive course chemotherapy treatments. In a recent department briefing on this bill, this portfolio committee was advised by the Department of Health officials that cannabis is available for medical prescription through certain applications regulated by the Medicines and Related Substance Act. We have received expert medical opinion on this issue and are advised that this is not the case, as cannabis is currently scheduled as a Schedule 7 substance by the Medicines Control Council, which expressly prevents and makes it inaccessible for medicinal prescription, even by a Section 21 application. We seek clarity on this issue from the Honorable Minister. In conclusion and brief summation, this bill passing into legislation is of vital importance, and we urge the Minister, the members of the Portfolio Committee on Health, and this government to use this opportunity for medical innovation and to develop regulations that will ensure the rational control of cannabis and other substances for medicinal purposes, whilst maintaining the flexibility to encourage ongoing research and development of a greater medicinal arsenal, which will ultimately be of benefit to all South Africans. The Inkatha Freedom Party supports this budget vote. I thank you.
Thank you, Ma'am Nkomo. Ngizobiza manje ubabu ilunga elihlukumekile ubabu Shaik Iman.
Thank you, Honorable Chairperson, Honorable Minister, Deputy Ministers, Honorable members, members on the gallery. Let me start off by saying, yes, it's true. We have serious challenges. We have problems. And I think we have all admitted that. But what we have not admitted is that those challenges need to be addressed. What we have not addressed is that we are here to represent 52 million people, not those that belong to any particular political party. Now, let me start off by saying and commending the the Department of Health, the Minister, the Deputy Minister, the DG, and the Department. Under trying conditions and with challenges around the world in health, I think you're doing a good job, and let me commend you for that. Honorable Chair, being a member of the Portfolio Committee on Health, I am privileged to acknowledge success in the provision of quality health care, including ideal clinics, distribution of medicines to churches and mosques to enable our people to assess these with ease, reducing the infant mortality rate, reducing maternal mortality rate, reducing the under 5 mortality rate, but I can go on and on and on, not forgetting their life expectancy from 57 to 62 years. The media communication plan to promote the prevention of infections, communicable diseases, and the emphasis on abstinence by the department and as alluded to by the Director General, I think augurs very well for healthcare in South Africa and good quality health. Honorable Chair, despite appropriate budgetary allocations, significant health facilities suffer with poor management, which ultimately results in drugs and essential medication. However, mechanisms being put in place to address the challenges faced, as alluded to by the DG, is welcomed by the National Freedom Party. Honorable Chair, health in South Africa is in good hands. as the NFP, we call on all relevant departments, including provincial departments and local government, to work together with the National Department of Health to ensure that all our citizens are provided with equal quality healthcare. Honorable Speaker, failure by other stakeholders to cooperate with the National Development of Health will indeed affect the service of quality healthcare. We call on the Department of Health to take whatever means necessary to ensure the success of the NHI, even if it means using the services of GPs from our neighboring countries until we have attracted enough GPs, as we believe it is one of the obstacles in the success of the NHI. We further call on the Department of Health to increase the intake of medical students. The proposal to identify learners with a passion for healthcare and introduce this as part of the curriculum from grade 10 is certainly an initiative that must be applauded. The NFP calls on the National Department of Health to accelerate on the nursing training framework. Honorable Chair, the process unfolding since the announcement of the Honorable President in his budget speech in 2014 that temporary workers working for more than 3 months will be converted to permanent, and the subsequent assurance by the Honorable Deputy President that this would be addressed by the Department of Health, I would be failing in my duty to advise this House and the public that much progress has indeed been made in this regard. Once again, let me congratulate the National Department of Health in this regard.
Thank you, Honorable Member.
Honorable
Your
Minister.
time is up.
Oh, till 13 seconds. Thank you. The National Freedom Party supports this budget. Thank you.
Sizobiza manje Sekela Ngqongqoshe kwezempilo. Order, honorable members. Order.
Honorable Deputy Minister.
Thank you very much, Honorable Chairperson, Honorable Minister for Health, Dr. Aaron Motsoaledi, Honorable Ministers, Deputy Ministers here present, our Chairperson of the Portfolio Committee, Honorable Dunjwa, and members of the committee, Honorable members of the House, distinguished guests, ladies and gentlemen, Dumelang. I'm honored to be here today to participate in the 2015-2016 budget vote for the Department of Health. Our budget vote debate takes place just over 6 weeks before we celebrate the 60th anniversary of the adoption of the Freedom Charter by our forebears at the historic Cape Town on the 26th of June 1955. The Freedom Charter became a beacon which guided us over decades of struggle for freedom, and today is the anchoring vision of our country embedded in our Constitution. This vision of the masses of our people is today the central foundation for the National Development Plan, which in turn is the central directive in our strategic plans, our APPs, and our programs. Guided by the key policies already mentioned, in the remaining 4 years of this administration will be, amongst others, focusing on the following key priorities: the promotion of health and prevention of diseases, and thereby reduction of the burden of disease in our country. Accelerate progress towards universal health coverage as we put in place the building blocks for the NHI and improve readiness of our health facilities for its implementation. Re-engineering of primary health, amongst others, increasing the number of ward-based outreach teams, contracting of health practitioners, expanding district specialist teams, and extending school health services. Improving health facility planning by implementing norms and standards. Improving management capacity at all levels by implementing at all levels with a focus on human resource management, financial management, supply chain management, and infrastructure development and maintenance. Honorable Chairperson, let me again remind this House that While South Africa, Africa, and the world remain challenged by a wide range of infectious communicable diseases causing major epidemics, these are not the only challenges. The epidemics grasp our attention and imagination because their threat to us is immediate, as in examples of the Ebola virus, various strains of influenza such as H1N1, and also some of the slow viruses which are epidemics such as the HIV and AIDS. While these remain huge challenges which we must tackle, I wish to remind us again that of the silent killers, collectively referred to as the non-communicable diseases. The reality we still face is that this category of diseases, which to differing extents can be prevented or effectively managed through change of lifestyle, remain a major drain on our economy and on our health resources. Our principal strategy remains that of promoting prevention and, in case where disease has already set in, expediting early detection and education on how to reduce their impact. The non-communicable diseases can be broadly grouped in 5 categories: hypertension and cardiovascular diseases, chronic kidney diseases, diabetes mellitus, cancer, and mental disease. While the causative or contributing factors vary in some of them, it is scientifically undisputed that the common factors are poor diet, use of tobacco in smoking or using tobacco in other forms, excessive use and abuse of alcohol, which at times also lead to the use and abuse of prohibited and harmful drugs, lack of adequate physical exercise. The tools available to us as government in helping our population avoid or reduce the dangers of these diseases are amongst the following: education and mobilization. Over the past year, we continue to build on previously laid foundation to educate the public, often working with organizations of civil society and those specifically focused on awareness, either broadly or focused on specific diseases. We want to take this opportunity to thank all those who have played an active role in the promotion of healthy lifestyles. Amongst personalities and organizations we worked with and hope to continue in this financial year is Pink Drive, whose main focus is on cancers, especially those affecting women, example, breast cancer and cancer of the cervix, and of late also focusing on the male cancers like prostate cancer. I want to take this opportunity to thank also Cricket South Africa and our Proteas national team for dedicating one of their one-day series games against the West Indies at the Wanderers Stadium on the 18th of January 2015 to Pink Drive and cancer awareness. We say to them, even though you did not win the World Cup, you remain our heroes and stars because of your social conscience. I also wish to single out our First Lady, Mange Mazuma, for her championing of awareness on diabetes mellitus prevention and management, and also First Lady Tobeka Madiba Zuma for her championing of awareness of cancer, especially those afflicting women, working hand in hand with Pink Drive. I must also congratulate our President himself for supporting the launch of the first annual Warriors Walking for Cancer on the 28th of February this year, where he finished 5 kilometers walk with no sign of sweat or effort. There are many other big and small organizations which work with us in promoting healthy lifestyles in all respects in terms of the contributing factors, and we are going to continue working with them, including businesses who are plowing back some of their profits into health promotion. We want to call upon other businesses, especially those in the health, food, hospitality, and sport and leisure areas to come on board. The other area of our involvement in managing the impact of non-communicable disease is, of course, legislation and regulation as a government. A lot of progress has been made in providing the necessary legislative and regulatory framework to protect the public from unscrupulous traders in the area of tobacco control, salt reduction, control of trans fatty acids, but a lot still need to be done, including with respect to excessive consumption of sugar. With respect to tobacco, a lot of gains have been achieved over the last 20 years, with the HSRC finding that adult smoking went down by 50% between 1993 and 2012. However, research shows that there are still some loopholes in the current act, but we are working on plugging these holes through legislative amendments. The elephant in the room remains the rampant excessive consumption and abuse of alcohol in our society. A lot has been said about the negative impact this has on our society. Work is still going on to thresh out legislative framework and legislative tool to stop the glamorizing of alcohol in our media, especially abusing our sports heroes. The third and fourth areas of our interventions are with regard to early detection of these diseases and management, whether through behavior adjustment, such as in adjusting diet, and if necessary, medical intervention. Organized programs of screening are available in our primary health facilities, but those have to be complemented also by outreach interventions and campaigns from time to time. In order to minimize on our limited resources, we are now also promoting one-stop screening service approach, in which outreach programs to screen for communicable diseases such as HIV and AIDS and TB will also include screening for non-communicable diseases. In this regard, together working non-communicable disease and also communicable infectious diseases, we are targeting in this financial year about 8 million people to be screened for both. Once people have been initiated on treatment, the challenge is always to make sure that they do not default, and the common disincentive in this regard is long queues at our facilities. The Minister has already alluded to interventions which we are making so that those who are stable should have no need to go to our facilities, but can collect their treatment at other facilities, including private pharmacies and so on. A few weeks ago, we hosted a summit on effective approach to chronic kidney disease, where the challenge of treating patients with end-stage kidney failure were highlighted. The summit was, amongst others, a sharp reminder that we must do everything to reduce the dangers of causative factors leading to kidney failure, because otherwise, once we reach the end stage of kidney failure, we have very limited resources in terms of hemodialysis and also in terms of a renal transplant. But also, the summit also sent a call for all of us to encourage South Africans to come forward in terms of pledging to be donors, because this can save life. Honorable members, the overriding message is that we must do everything in our power to prevent non-communicable diseases rather than rely on treatment. Chairperson, the meeting also, we also have a responsibility to look after the most vulnerable in our communities, that being the disabled. We have, through our research, established that we're still very limited in terms of our capacity to respond to the needs of the disabled in terms of wheelchairs, learning aids, artificial limbs, and so on at our facilities. And this is a matter which we are addressing, because we found out that we could only respond to 57% of the needs in a 2014 survey. Honorable Chairperson, we also managed to increase the number of high-risk individuals who have been able to obtain seasonal influenza vaccination, but a lot still needs to be done in this area. We have been progressively increasing. The Minister has already spoken about our response in terms of the Ebola virus outbreak, but I can only just add to say that this has helped us to make sure that we can increase our outbreak response teams through training and also making sure that most of all our ports have surveillance capacity to make sure that we can detect any possibility of this disease, epidemic such as Ebola. Malaria is another area where we are working very hard, not just to reduce, because we have done fairly well over the last couple of years to reduce incidence of malaria, but in this area, our target is actually elimination of malaria. Honorable Chairperson, the Minister has already stated that the African ministers have resolved that what we need to focus on is to strengthen our health delivery services. And in our case, one of our major focus areas is to improve quality of care in our hospitals of all ranges, from central, tertiary, regional, and specialized hospital. In order to achieve a good quality hospital service, we have a plan to radically reform central hospital management and governance. Our intention is that at the level of central hospitals, the boards and management should be given maximum possible delegations to manage our resources. All our hospitals from central, tertiary, and regional and specialized should adhere to national core standards as established by the Office of the Health Standard Compliance, and a lot has been achieved in this area. We have made a lot of progress in that in the 2014-15 financial year, we had targeted 2 tertiary hospitals to have full package of tertiary 1 service, but we are able, instead of just 2, we're able to gazette 4. In the 2015-16 financial year, we plan to have all 10 central hospitals with full-fledged delegated authority, 4 additional tertiary hospitals with full tertiary 1 package, also to have more central and tertiary hospitals fully compliant with the national core standards. Honorable Chairperson, in the area of emergency medical services, we did say last year that we will publish regulations to improve our capacity nationally in this regard. I'm pleased to announce that indeed those regulations have been published and are now being implemented. And in the area of forensic pathology, we have also seen an improved turnaround in the performance of autopsies, but also in the area of blood samples. We know that there have been a lot of outcry, especially where it involves testing for alcohol. We have now opened a forensic laboratory also in eThekwini in KwaZulu-Natal, which will make sure that samples for Eastern Cape and KwaZulu-Natal no more have to be sent to Gauteng and the Western Cape. Honorable Chair, just to touch a bit on some of our public entities, there has been reference already by the Chair to the Medical Research Council, which is doing sterling work. Amongst the programs which we can highlight is the National Health Scholars Program, which was developed as part of the Department's Human Resource for Health Strategy, with the purpose of supporting education and training 1,000 doctoral candidates. I'm pleased to announce that a lot of progress has been made in this regard. We already have 4 PhD students who have already completed and 1 MSc, and the MRC is also confident that by the end of this financial year, additional 7 doctoral students will have completed. And tomorrow I will be participating on behalf of the Ministry and the Department for the official launch of this program, which is targeting 1,000 doctorates in health services over the next 10 years. Thank you very much, Honorable Chairperson.
Thank you, Honorable Deputy Minister. Honorable A.D. Alberts.
Thank you, Chairperson. Proper health care is of utmost importance for South Africa's general well-being. That much is obvious. However, healthcare for the sake of healthcare is not good at all. If the healthcare system is not operating properly with professionalism, a caring attitude, and the awareness not to do harm, then it is better to have a very limited one. The Hippocratic Oath declares, first, do no harm. Yet many people in this country see state hospitals and even private hospitals as places where you go to die. In the United States, it is said that more people die in hospital due to medical malpractice than those who die of cancer. One can only imagine what the true numbers of people killed in South African hospitals are. If lawyers sue the Department for Medical Malpractice, then it is not the lawyers' fault for doing their job on behalf of their clients, but the people in charge of the medical system itself. The buck therefore stops with you, Minister, to ensure a caring and professional healthcare system. In Suid-Afrika werk die gesondheidstelsel nie na behore nie. Daar is talle gevalle van mediese nalatigheid, in baie gevalle grove nalatigheid en selfs opsetlike skade wat aan pasiënte aangerig word. Die hartseer is egter dat die gebrekkige ondersteunende stelsel te hospitale en klinieke wat behoorlik moet laat befunksioneer, soos elektrisiteit en watervoorsiening, ook 'n wesenlike rol speel in die sterftesyfer. Ek kan hier 'n voorbeeld noem van 'n man in Limpopo wie sy vrou aan ventilators gekoppel was en toe gesterf het toe die krag afgegaan het. Minister, u moet vir ons sekerheid gee oor die voorsiening van krag in alle hospitale en klinieke. When it comes to the regulation of medication, I wish to quote Nicholas Taleb. There is an element of deceit interventionism. It is much easier to sell, look what I did for you, than look what I avoided for you. Our whole system is designed to intervene at every level to our detriment. The regulations mandating, for instance, that only those cares that have been scientifically verified may be sold is a good example. The problem with this thinking lies in the fallacy that the absence of evidence is evidence of absence. There are many cures in existence that we merely fail to understand as yet. To regulate them out of the market is based on the false presumption that we know everything already. This is a mistake. The system must be designed to allow freedom of education and personal choice. Indien mense die vryheid om medisyne volgens hulle keuse te maak, veral vir voorkoming van siektes, sal daar minder druk op die gesondheidsstelsel wees en sal minder mense hospitaal toe gaan en sal minder sterf weens mediese nalatigheid. Ek is daarom bly om te verneem dat die minister wel aandag gee aan voorkoming. Lastly, the minister must revisit the patent rules on generics so as to find a balance between cheaper medicine in the form of generics and allowing the industry to source funding for R&D, especially with regard to the growing resistance to antibiotics. By 2020, we might not have any antibiotics that will work or still work. Further research on this is crucial, and perhaps more research in alternative medicines and indigenous remedies must be encouraged. Interestingly enough, researchers in the UK found quite recently that a strange remedy from the dark Middle Ages actually kills viruses and bacteria. They are now researching why it works. We need to do the same here as a superbug in Africa will do to Africa's endemic poverty, kill more than any conflict in recent times. Thank you.
Thank you, Honourable Member. I'm calling upon Honourable Dick Carter.
Thank you, Chairperson. Patients in South Africa face a double jeopardy, ill health and a failing health service. The National State Laboratory manifests many of the causes. Leadership is lacking and money has dried up. Staff is leaving and mistakes in test results are horrifying doctors. In KZN, we are not sure who our HOD is or who the CFO are. Stores have staff clocking in daily, but here there is just absolutely no work for them to do. That can be seen in KwaZulu-Natal. In the Northwest, the provincial DOH's finances will be co-managed by the provincial treasury because of financial instability and the history of mismanagement of budgets. According to Ground Up, clinics that feed the Chris Hana Paraguana Hospital have limited functional basic equipment, forcing them to send patients up the referral system for the most basic of ailments, such as blood tests and ECGs. Thus, this is clogging up the referral system. In the Free State, we are subjected to expose after expose on primetime TV. Exposing gross maladministration, Honourable Minister, under a recycled and already disgraced MEC. When will we see intervention in the Free State? Minister, prevention is better and cheaper than treatment and cure. And COPE welcomes the achievements on the new vaccinations. The media is reporting an extremely virulent flu this year, and the question is, will we be able to provide everyone with a vaccine that is not on a medical aid? My next point is the needless retirement of doctors in state employ at the age of 65. The United States, England, and India are all testing increasing the mandatory retirement age to be 70. Doctors who pass the required cognitive and health test and who are fit and willing to continue must have that avenue open to them. Teaming such doctors with new graduates will become a two-way street. Older doctors will be brought up to date. Younger doctors will have a benefit of an older doctor's experience. Both doctors and patients will then benefit. Chairperson, how will the department deal with a critical shortage of doctors in the country? University process in excess of 3,000 applications a year. But as we've only got 8 medical schools, they can only accommodate around 1,300 doctors a year. The 8 medical schools deliver an average of 1,100 to 1,300 young doctors every year. But taking into consideration the growth in the population, South Africa needs a minimum of 3,000 doctors every year, and we cannot afford to lose one of them through immigration. The extensive overtime worked by these young doctors in the first 3 years. Make them run for the first plane ticket abroad. Who can work for 128 hours unpaid overtime in a month? Sadly, an overtired doctor's mistakes are either buried or cremated. Then we acknowledge that Cuba has been very generous in assisting with training of doctors. But of concern to the Congress of the People is that Cuba does not face the same strain and level of life-threatening diseases as we face in South Africa. It is therefore advisable that if young doctors return from Cuba and or anywhere as a matter of fact, that they should be provided with a bridging year of training to fill the gaps. And those are examples of HIV/AIDS that the honourable members are chirping about on the right-hand side. Honourable Minister, university exit requirements should be of a higher standard.
I'm afraid your time has
and on the
expired.
same level throughout
Thank
the
you
country.
very much.
I thank you.
Thank you very much, Honourable Member. Honourable Dudley.
Thank you, Chair. Honourable Minister, the ACDP would like to use this opportunity to raise the issue of state prison health, where there's one professional nurse for every 195 inmates and one doctor for over 14,000 prisoners. Now, according to the World Health Organization, the prison population needs access to more doctors than the general population, as they tend to suffer more illness than people who are not in prison. For example, prevalence of TB and multi-drug resistant TB in South African prisons is estimated to be between 3 and 7 times that of general population, as overcrowding and lack of ventilation, as you know, promote increased transmission. In fact, both the HIV and TB epidemics are made worse by the chronic shortage of health and other workers in prisons, with correctional services being unwilling or unable to fill the required posts. A lack of staff often means inmates are stuck in their cells for 23 hours a day with no security official to escort them to the pharmacy to even collect essential medication. According to Zonke Gender Justice, an organization that advocates for access to medical services in prisons, in the 2012-2013 financial year, 652 inmates died of what was categorized as natural deaths, but a great many of these deaths were in reality related to TB and or HIV. Being sick in our prisons is a death sentence for too many people. The ACDP calls on the Department of Health to work with the Department of Correctional Services to ensure relevant vacancies are filled with trained and capable staff, and that oversight and accountability structures are established and monitored. Another area of concern is, for us, the problems of governance in the Eastern Cape that continue to impact negatively on the health sector, and health standards continue to decline. You know, people are asking, why is it taking so long to sort out these issues, which result in many resignations of doctors and specialists, shortages of stocks and poor maintenance, like non-functioning lifts. At Dihlabeng Hospital, for example, only 4 out of 20 medical officers that existed in 2012 remain. Reports say only emergency procedures are being performed and surgery patients are being turned away. The bottom line is patients are dying from a lack of staff and medication. Many hospitals are said to be teetering on the brink of collapse, barely managing. Honourable Minister, the Treatment Action Campaign said last year that the success of your second term might be defined by the extent to which you are willing to have underperforming MECs challenged or replaced. And while we hold you responsible for performance of MECs, we do realise that their replacement and removal is largely out of your hands. The ACDP lastly would like to thank you for your unequivocal stand that you've taken in opposing assisted suicide. And we will be supporting this budget, which continues to face many challenges. Thank you.
Thank you very much, Honourable Member. Honourable Esam Chafta.
Thanks, Chair. Honourable Chair, while the Department of Health seems to be doing its best to produce positive health outcomes as envisaged in the National Development Plan, a lot still needs to be done to improve the health system so as to work for everyone. In the department, the development of human resources and recruitment and retention strategy is very crucial towards the improvement of health services to the poor communities, especially those in rural areas. Most clinics in the most remote areas suffer a lot. Most of them have no operational management for years, and no plan seems to be working to have them employed in the near future. And nurses do not stay very long there. It is even worse for the department when you find that such clinics do not have telephones to call for emergency services. Nurses must use their cell phones. The demand for the support to be given to the provinces and districts increases, and the department must be ready to overcome that. Honorable Chair, also associated with the human resource development and recruitment is the issue of increasing use of labor brokers, the so-called e-agents, which began in private hospitals, but now getting into public hospitals in other provinces. I am not sure how this assists towards the achievement of National Development Plan goals, especially the creation of job opportunities. But the AIC believe the department must do something to deal with this. We see it as another way of creating a poor working but unemployed class within our society. Honorable Chair, I also want to commend this department, especially in the province of the Eastern Cape, about its intervention in the traditional circumcision still practiced in some areas to minimize and eventually end the death of initiates in initiation schools, and doing that without interfering in any culture or tradition of the people. More support is still required, especially in the form of training the traditional surgeons and nurses and providing more equipment and vehicles to visit the schools, but of course, Honorable Chair, by only those who have a right and understand those traditions. Another issue, Honorable Chair, is the one-stop shops opened in different provinces to assist the ex-miners. The challenges are that people do not have the knowledge of these in their respective provinces. The distance to these one-stop shops is presenting problems to the people, and the space allocated for the offices in the chosen hospitals is very small, resulting to the offices serving very few individuals a day, e.g. in the Eastern Cape at Amtata, where only 15 people are served a day. The department, together with the Department of Mineral Resources, must look at the above challenges and find solutions. Honorable Chair, the AIC supports every plan aimed at improving the lives of the communities. We see this as not different from that, therefore support the budget. I thank you.
Thank you very much, Honorable Member. Honorable Folming.
Honorable Chairperson, today I would like to speak to you about the story of the Sibetsu family. Early this year, Matapani Sibetsu rushed a 3-week-old baby to the 24-hour Lenasia South Clinic in Gauteng because a child had become severely ill. When she arrived at the clinic, she was refused entry by the security guards, who claimed that the doctors had gone home. Shortly thereafter, Queen Sibetsu, the baby, died in a waiting mother's arms. So I just want you to imagine that for a moment. Imagine you were that mother holding your baby and losing her like that. Our Bill of Rights states that, quote, no one may be refused emergency medical treatment, unquote. Yet not only was this child denied that treatment, she was also robbed of her fundamental rights to human dignity and life. This tragic case reflects the barriers faced by many with regards to accessing emergency medical services, or EMS. Honorable Chairperson, the EMS system is in many ways broken. If we're going to fix it, we need to refocus on the basics. So let's consider the patient's journey. We all want the assurance that if we or one of our loved ones became critically ill, that we could pick up the phone, call an ambulance, and that we'd receive a rapid response and access to quality healthcare. However, we may find that we impeded even at that initial point of contact because the 112 emergency centers have not yet been fully established. So although the Electronic Communications Act back in 2005, that's almost 10 years ago, that's 10 years ago, obligates the establishment of these centers. When I put a written question to the Minister of Telecommunications and Postal Services, I was told, quote, currently there are no plans to implement the 112 emergency call center, unquote, and that no funds were allocated to this for the 2015-2016 financial year. Now, 112 call centers are vital because they allow us to accurately identify emergencies and mobilize ambulances to respond. Furthermore, they help to ensure that we have correct information for health planning. A lot of the information we have, for example, in terms of response times is dubious because we cannot get the data to verify it because there aren't functional 112 emergency centers. But access is just the first step on the journey. We also need high-quality care for patients when they arrive, and I'm glad that the Deputy Minister mentioned the national core standards because they indicate, for example, that waiting times is very important, and managing waiting times in particular is important for healthcare quality. However, in a written response I recently put to our Minister on waiting times, which includes waiting times in emergency departments, I was told, or it was acknowledged, that, quote, there is no formal mechanism to monitor patient waiting times at provincial level. It is therefore not currently possible to detail patient waiting times accurately, unquote. Now, Honourable Chairperson, I say this respectfully, how on earth can we manage something if we can't measure it? Moreover, how can we say that we're reducing waiting times in emergency departments if there's nothing accurate to measure it against in the first place? Finally, we need to address national EMS planning. Currently, EMS represents about 4% of the Program 4 budget. Now, the Program 4, or the primary healthcare budget, constitutes about 0.3% of the national budget. We understand that the delivery of EMS falls on the provinces. We get that. But I think we'd all agree that strategic planning of these services at a national level is a priority, which makes the sliver of 4% or 0.3% of the budget mind-boggling, to say the least. Thus, the DA would appeal to the Minister to, 1, present a timeline to us for the full implementation of 112 emergency centers, even if it means taking over from the clearly disinterested Department of Telecommunications and Postal Services. 2, ensure that the quality of emergency care at health establishments is comprehensively monitored. And 3, increase investment in EMS strategic planning at the national level. We cannot make up for the tragic loss of little Queen Sibetsu. It's not possible. But what we can do is we can work hard to prevent such a tragedy from ever happening again by fixing EMS. And we as a Democratic Alliance will be relentless in exacting accountability on this because we cannot afford to lose another precious life. Thank you.
Thank you very much, Honourable Member. Honourable Skippers.
Honourable Chairperson, Honourable Ministers and Deputy Ministers present, Honourable Members, Honourable MECs present, DGs and officials of the Health Department, distinguished guests, ladies and gentlemen. Honourable Chair, the ANC remains true to its promises of providing a better life for all South Africans, irrespective of race, gender, or religious affiliation. As the ANC government, we have illustrated our commitment through the great strides we have made in the past 20 years to improve the living conditions of South Africans from all walks of life in various areas. The budget vote presented by the Minister today is another demonstration of a government at work to improve access to health services to all its citizens, rich or poor. Honourable Chair, over the past 20 years, the government built more than 1,500 healthcare facilities, and existing ones revitalized to ensure that everyone can access healthcare within a 5-kilometer radius of their home. 18 new hospitals have been built, and more than half of the 400 public hospitals in South Africa have been renovated. Under the apartheid regime, the health system was characterized by 14 different health departments, fragmentation and duplication. Since 1994, reconstruction of the system has been progressively realized. However, high levels of poverty and unemployment mean healthcare remains largely the burden of the state. The Department of Health holds overall responsibility for healthcare with a specific responsibility for the public sector. Provincial healthcare departments provide and manage comprehensive health services via a district-based public healthcare model. Local hospital management has delegated authority over operational issues such as the budget and human resources to facilitate quicker response to local needs. There are 4,200 public healthcare facilities in South Africa. People per clinic is 13,718, exceeding the World Health Organization's guidelines of 10,000 per clinic. However, figures from March 2009 show that people average 2.5 visits a year to public health facilities, and the usable bed occupancy rates were between 65% and 77% at hospitals. Since 1994, more than 1,600 clinics have been built or upgraded. Free healthcare services for children under 6 and for pregnant or breastfeeding mothers was introduced in the mid-1990s. The National Health Laboratory Service is the largest pathology service in South Africa. It has 265 laboratories serving 80% of South Africans. The labs provide diagnostic as well as health-related research. Honorable Chair, the ANC's 53rd National Conference in 2012 noted that the national health system currently experiences a critical shortage of professional and technical staff, that nursing remains the backbone of the healthcare system, and while it is important that nurses continue their studies at universities, universities cannot be the primary training platform for the nursing profession, as the training of nurses is mostly a bedside experience. Conference resolved to welcome the National Human Resource Strategy for Health. The primary training for nursing colleges should be located at nursing colleges inside the hospitals. Conference called upon the department to accelerate the refurbishment of such colleges, to accelerate the training of health professionals in collaboration with the Ministry of Higher Education and local universities. The Department of Health finalized, approved, and implemented its 2012-2017 Human Resources for Health strategy that was launched in October 2011. This strategy aims to ensure that South Africa has an appropriate, trained, and sustainable workforce to achieve the objective of good health outcomes. The Ministries of Health and Higher Education and Training are collaborating to finalize the demerger of the University of Limpopo and Medunsa. In March 2012, 165,371 qualified health practitioners in both public and private sectors were registered with the Health Professions Council of South Africa, the health practitioner watchdog body, for those who don't know. This includes 38,236 doctors and 5,560 dentists. The doctor to population ratio is estimated to be 0.77 per 1,000 because the vast majority of general practitioners, 73%, work in the private sector. There is just one practicing doctor for every 4,219 people. In response, there has been an introduction of clinical health associates, mid-level healthcare providers to work in underserved rural areas. Honorable Chair, approximately 1,200 students graduate annually. In some communities, medical students provide health services at clinics under supervision. Newly graduating doctors and pharmacists complete a year of compulsory community services in understaffed hospitals. In an attempt to boost the number of doctors in the country, South Africa signed a cooperation agreement with Cuba in 1995 during the Nelson Mandela administration. South Africa has since recruited hundreds of Cuban doctors to practice here, while South Africa is able to send medical students to Cuba to study, with the exception of the Western Cape Provincial Health Administration, who has chosen to abstain from this program. South Africa believes the Cuban opportunity will continue to help train the doctors it so desperately needs for the implementation of the national health system and the related national insurance scheme. Other agreements exist between Johannesburg Hospital and Maputo Central Hospital. The government also made it easier for other foreign doctors to register in the Republic of South Africa. The Allied Health Professions Council of South Africa had 3,373 registered complementary health practitioners in 2012. Honorable Chair, everyone who is detained, including every sentenced prisoner, has the right to conditions of detention that are consistent with human dignity, including the least exercise and the provision of at state expense of adequate accommodation, nutrition, reading material and medical treatment, healthcare and correctional services is however rendered in accordance with the Department of Health's legislation, policies and guidelines in an effort to contribute to the key outputs which are consistent with the Millennium Development Goals. HIV and TB management is rendered in accordance with the National Strategic Plan 2012-2016 for HIV, sexually transmitted infections, and TB, as well as the Correctional Service TB Management Guidelines of 2013. In terms of HIV/AIDS programs and services that are offered include counseling, testing, and linking inmates.
Honourable Member, I'm
Thank
afraid
you.
your time has expired.
As the ANC, we support the budget.
Honourable James.
Thank you, House Chair. Last year, Honourable Chair, the DA highlighted the meagre allocation of funds to the program for primary health care services. If primary health care worked well, our country could spend much more on treating diseases and discovery research. The poor and the most vulnerable in our society are the ones who still face major inequalities in the public health sector. Program 4 aims to improve our district healthcare system, increase access to primary healthcare services, administer port health services, improve the management of non-communicable diseases, improve access to and quality of mental health care services, attempt to eliminate malaria by 2018 and improve SA response to influenza. Certainly, allocations in other programs in the budget are also aimed at improving primary health care, but this program is still majorly underfunded. Honorable Speaker, every year, the patient satisfaction survey produces the same results. Lack of assistance from healthcare workers and a negative attitude towards patients. Long waiting queues for emergency care and dispensing of medicines, and poor conditions at clinics, filthy wards, beds, linen, and largely poor infrastructure. The results highlight the colossal issue of shortage of staff. Nurses, doctors, and the general assistants needs to be employed, Honorable Minister. Our vision as the DA is for the citizens of this country to redress the imbalances of the past so that every individual, regardless of race, can equally enjoy their basic human rights to access quality primary health care. This budget has to address the challenges that the poorest face in our country. They are the ones who suffer on a daily basis. Our people must be served with dignity.
Honorable Member, I'm afraid your time has expired. Honorable Marcel. Honorable Member.
Honorable Chair, Honorable Minister, Honorable Deputy Minister, Honorable members, and esteemed guests. Honorable Chair, the Freedom Charter states that we, the people of South Africa, declare for all our country and the world to know that South Africa belongs to all who live in it, black and white, and that no government can justly claim authority unless it is based on the will of all the people. Mark that. The preamble of the Constitution of the Republic of South Africa proclaims, we, the people of South Africa, recognize the injustices of the past, honor those who suffered for justice and freedom in our land, respect those who have worked hard to build and develop our country, and that South Africa belongs to all who live in it, united in our diversity. Honorable Chair, the people shall govern. We are committed to building a South African nation that is diverse. The birth of a nation is never an easy task. We began this journey by removing all forms of legislative and institutionalized discrimination on the basis of race, color, gender, religion, culture, and sexual orientation. For these freedoms, we fought hard. They were not gained through the ballot box, but through the battlefields. It is our task to work together to foster the social cohesion, build a common South African nationhood. The Nation Development Plan, NDP, that is overwhelmingly supported by the nation, is an overarching plan and a vision to realize the ideals of the Freedom Charter. Honorable Chair, a healthy nation is a wealthy nation. Quality health care for all is our goal. Our flagship program in the next 5 years and beyond it, the National Health Insurance, is what we are striving for. The National Insurance Health will be publicly funded and administered and will ensure that South Africans have access to comprehensive quality health services irrespective of their socio-economic status. Honorable Chair, the establishment of the National Health Insurance Fund will be publicly funded and administered and give effect to 3 key principles of the National Health Insurance: universal provision of quality health care, social solidarity through cross-subsidization and equality, which delivers free health care at all the points of service. The NHI aims to also improve the healthcare services by improving the quality and professional service at the point of delivery, with the facilities which being ideal, reform the health the health private care to drastically bring down the cost of health care. Honorable Chair, through the adherence of the patient's charter, the quality of public health service will be enhanced. A patient-centered approach in all delivery of health services will be instituted by aggressively reducing the time patients have to be waiting to receive service and medication. The outcome of the NHI will be universal healthcare coverage, re-engineering the primary health care, reduction of health care costs, improved health care and management, leadership, human resource reskilling, and capacitation of all the health facilities, planning infrastructure delivery, prevention and proper management of HIV, AIDS, and TB, reduction of maternal, infant, and child mortality rates. Honorable Chair, the purpose of the primary health care is simple: to develop and oversee implementation of legislation, policies, systems, norms, and standards for a uniform district health system, environmental health, communicable disease and non-communicable diseases, health promotion, and nutrition. The Primary Healthcare Service Program aims to develop and implement a uniform district health system and to develop policy for district health services. The program's budget increased by 4.1% in normal terms in 2015-2016. But in real terms, it is decreased by 0.7% in 2016. Establishment of a National Health Commission to address the social determinants of health, reduce risk factors, and improve management for non-communicable diseases, improve access to and quality of mental health services in Africa. Hand hygiene campaign launched and targeting commuters, early childhood development centers, and schools will be vigorously pursued. Honorable Chair, the program for the current financial year, 2015-2016, is to ensure that 15 districts have uniform management structures for primary health care facilities, 1,000 healthcare facilities with functional clinics, 200 functional ward-based primary health care outreach teams, 500 primary health facilities qualify for ideal clinic status, 20 municipalities meet environmental health norms and standards, 8 million people screened for high blood pressure and high glucose levels, 28%, that is 16% prevalence for people screened for mental disorder, 16% of mental health patient units are attended to at designated district clinics and regional hospitals. Honorable Chair, we note that the following additional areas would present budget pressures: transfer of port health services from provincial department amounting to 108 million rand, setting up health attaché offices in Cuba and its impact on how it will be affected by the dollar-rand exchange rate and an annual contribution to the World Health Organization. Allocating additional funds to sector-wide procurement. Funds were received from Democratic Health Survey of about 30 million rand, while the real need is in excess of 80 million rand. Honorable Chair, the Department of Health, through its budget vote, will speed up the delivery of quality health care to the people of South Africa by capacitating the health practitioners, creating conducive ideal health care facilities which are compliant with norms and standards of the highest order. Hence, the process of transformation of the ideal clinic into ideal standards, where everything needed to deliver quality health care is available and free for those who cannot afford it, who cannot afford the exorbitant private health care. This budget will endeavor to speed up the transformation of the healthcare sector landscape in South Africa. Now, we say, tell no lies and claim no easy victories. But it is a hackneyed type of quotation in this house where everybody all the time try to do politicking. And the worst thing that can ever happen to any society is dog whispering politicking. Politics, this is worse. The majority of doctors are in private sector simply because that's where they milk the system. That's where money is made. They don't care about it. And all doctors are given subsidies by the government to train. And they are supposed to be...
Madam Chair. Madam Chair.
Yeah, you see, it is very important.
Okay. Honorable Maisela? Honorable.
Honorable Maisela, may I please ask you one question?
Honorable Maisela, would you like to take a question from the honorable
Sit
member?
down.
Let me just say one sentence, I'll take your question.
Please sit.
With that, the ANC supports the budget, all right, by vote, and all the Department of Health and all its entities. So I can take your question, ma'am.
Are you confirming to public?
Sorry?
Are you confirming to public that you train doctors, then they go to public sector?
I don't know what you want to say.
I'm asking Honorable Maisela, not you.
Honorable member, please ask your question.
Ask your question clearly and cogently.
I'm saying, are you confirming to this public that you train doctors and thereafter they don't serve public, they go to private sector?
No, I didn't say so. All I'm saying is that all doctors in South Africa are subsidized by the government, all right? And when they finish, they go where the money is. They forget that it is through the people's funds, the people's taxes, that they become doctors. And some of them, you know what? We export the most important thing that we export as South Africans is medical expertise.
Order.
All the doctors, all the nurses, and everybody, after training hard here, because maybe they think we are guinea pigs, migrate to Europe, to America, and everywhere. All right? But the important thing is we are proud of that because they do as well. They are the best sought medical practitioners in the world. I know this. I'm not guessing that. I know it as a fact. And the national health system in Britain is run by our doctors and our nurses. The best medical scientists are found in South Africa. We were the first to do the heart transplant and all other things. And we were the first, by the way.
Order.
Yeah, because you see, ignorance is not a bane.
Honorable Kalyan, why are you standing on your feet? Why are you on your feet?
No,
I'd like to ask a question.
If you can't stand the heat.
Honorable Maisela,
Yes, sir.
take your seat.
If you can't stand the heat, get out of the kitchen.
No, Honorable Maisela. Unfortunately, Honorable Kalyan, Honorable Maisela has finished his speech before I recognize him.
He ran away. Honorable Chair, it's not about the Honorable Marcela.
Honorable?
It is about the behavior of members sitting on the ANC side. Is it parliamentary to shout at members of this side to shut up and then go again, shut up?
Honorable members, sit down. Honorable members, let us refrain from using unparliamentary language towards each other. That's all I can say. Let's refrain. Re tlo bitša tona ya tša maphelo go tswalela dingangišano.
Thank you very much, Honorable Chairperson. I thank you for the inputs that were made by several members in this debate, and I would like to respond to a few of them. Honorable Chairperson of the Portfolio Committee, Honorable Dunjo, was asking about Mom Connect in rural areas. I want to confirm that all the clinics and hospitals in South Africa can register women for Mom Connect. We have trained 4,000 nurses who are doing this job. So every pregnant woman during their first visit for antenatal care can actually register in each of those establishments in our country. Honorable James, I will propose that the evaluation of services in our hospitals must best be left to the experts. That's why we establish the Office of Health Standard Compliance. That's precisely why it was established by this government. That's why in England, they have got the Office of Quality Care Commission. If you visit our hospitals for whatever purpose as a politician.
Honorable Ollis.
Chairperson, I'm sure you are going to increase my time.
Please.
I'm sure you are going to increase my time
If
because
you
the
want to
honorable member is
interject,
wasting my time.
If you want to speak, just raise your hand and I will recognize you.
Okay, I'm raising my hand.
Not now, please.
When?
I was just asking you to do that.
It is insulting us.
Honorable Ollis, Honorable Ollis, it's not the first time that I ask you to please sit. Please do that. And I won't stop you from raising a point of order as long as you do it correctly. Continue, Minister.
Yes, I was making a statement, Chairperson. I don't know why is it provoking this type of arguments. Just to say, this parliament passed a law on Office of Health Standard Compliance and gave them the power to go and evaluate and inspect our hospitals with objectivity. That is the office that is objective to be listened to. If you visit as a politician, don't pretend to be an expert in this field because your eyes will be clouded by the political party you belong to. That is the point I'm making. So it will never be objective. That's why when I stand here to give success on statistics, I'm talking about that which was done and evaluated by experts. For instance, when I spoke about the impact of vaccines, I'm not talking about what we did as a political party or as a minister. I am talking about what was done by the NICD, the National Institute of Communicable Diseases, which is a world-class institution. That's why with Mom Connect, while I'm giving figures about mothers here who have registered and those who have complimented us and those who have complained, but I also said then we are giving University of Stellenbosch and University of Western Cape, to evaluate the impact on pregnancy and childbirth and to evaluate the impact on taking care of infants. Those are experts. Me and you will always be clouded by the political parties. So we must not pretend to be experts in this field.
Just take your seat for a while. Honorable James.
Would the minister take a question?
Will the minister take the question from Honorable James?
I was going to, unfortunately, I don't have enough time.
Thank you, Honorable James. Please sit.
I've got lots of questions, Honorable James. I will take your questions some other time. The other issue that has been raised here, which is very important, I believe, is the issue of Cuban students. What the Honorable Member, Honorable Carter is proposing is already happening. Cuban students finished their last year of study here in South Africa. They don't compete in Cuba. They come to South African universities precisely because we have got different disease patterns. In Cuba, they have done away with most of the diseases that are still troubling us. So they will definitely be disoriented. But secondly, because the training in Cuba is about primary health care, prevention of disease and promotion of health, whereas our training is mostly curative, and that's where the differences is. Honorable Dudley, the issue that we spoke about is going to be debated in this parliament very thoroughly, I must promise. That's why I never raised it in the speech, because it's going to be a lengthy debate. I can see there's a lot of excitement going around the country that there is a breakthrough. I don't know what breakthrough is that all about, but this issue is going to be debated here in Parliament scientifically, without emotions, and will bring facts here in front of the House. That's why I never had time in my speech. Honorable Volming, we agree with you about emergency medical services. And for this reason, for the past, I think it's 36 months, if I'm not mistaken, I appointed a team led by Professor Wallis, who is an expert on emergency medical services from University of Cape Town, who has got a team. They've moved around the whole world checking emergency medical services, how they are run. It's not something that we rushed into. And they've given us a report. We've written regulations. They are now in the public. And I think by the end of the week, if I'm not mistaken, there's going to be a government gazette about that. So we have done a thorough homework about emergency medical services, because we want them to be the best. And one of their recommendations is that all ambulances, public or private, must use the same color. And again, that all ambulances, public or private, must use the same 11 number. That is in the recommendation of that task team, and we are going to implement.
Thank you. At
Thank
that
you.
note. Thank you, Tunaya Jamapil. Members are reminded that the debate on planning, monitoring and evaluation, and transport budget votes will take place at 16:40 in the National Assembly Chamber and Old Assembly Chamber respectively. And that, honorable members, concludes this debate and the business of this extended public committee. Thank you. The committee will now rise.